Hey everybody, this is Dr. Sadler again here with our question of the week. Okay, so let's look at this week's question of the week. The nurse is caring for a client who experienced an embolic stroke. Which assessment finding would cause the nurse to be concerned about the client's respiratory status? So we're concerned about their respiratory status. Our options are dysphagia, hemiparesis, unequal pupil response to light, and number 4, limb ataxia. So, all of these are things that can occur with a stroke, right? A person that had a stroke, depending on where the stroke was, how severe it was, a lot of different factors can cause an individual to have any of these things, right? So let's look back at the question. The question is specifically asking which one would the nurse be concerned about regarding the client's respiratory function. Respiratory function. Which one is going to directly impact or could directly impact the client's respiratory function? Remember, a person with dysphagia, what are they at risk for? A person with dysphagia is at risk for altered nutrition. Dysphagia is difficulty swallowing, right? So difficulty swallowing. And so they're at risk for altered nutrition, but they're also at high risk for aspiration pneumonia. Aspiration pneumonia directly impacting the patient's respiratory risk. So that would be our answer. So, like I said, all of these, so you got to look at the question. What exactly is the question asking you? Because, like I said, all of these could be some issues and concerns for a person that has had a stroke. But the question is specifically asking about their respiratory function. And dysphagia will cause or can cause aspiration pneumonia if not treated appropriately. And so, like I said, our answer is dysphagia. Each assessment finding and rationale is each assessment finding will concern the nurse and require further assessment and interventions. However, dysphagia is the only one that impacts the respiratory status, as aspiration pneumonia is a high risk for this particular patient.